Dr. Arthur Mark here, and today we're going to talk about the first sign of kidney disease, and this one really does catch a lot of people off guard. Most people think if something is wrong with the kidneys, you would feel pain right away, you would feel something dramatic, something obvious, something that stops you in your tracks. But the kidney usually does not work like that. It is one of the quietest, hardest working organs in the body, and because it works so quietly, people often miss the early warning signs. Now just think about what your kidneys actually do. Yes, they help make urine, but that description is way too small for what these organs are really doing for you every minute of the day. Your kidneys are not passive strainers. They are not just little coffee filters sitting there waiting for waste to show up. They are active, selective, incredibly intelligent filters. They decide what stays, what leaves, what gets recycled, what gets balanced, and what has to be removed before it creates trouble somewhere else in your body. Every single day, your kidneys help regulate fluid balance, electrolyte balance, acid balance, blood pressure, red blood cell signaling, and even bone health through vitamin D activation. In other words, these organs are doing chemistry, engineering, quality control, and waste management all at once. And they do it non-stop. Even while you sleep, even while you travel, even while you are doing absolutely nothing, your kidneys are busy protecting the internal environment that keeps you alive. Now let's make this a little more real. If you drink, let's say, around 2 liters of fluid in a day, you might assume your kidneys are only dealing with roughly that amount. But the amount of blood flowing through these organs is enormous. The kidneys filter a huge volume every day, and then they carefully reabsorb almost everything your body still needs. So they are not just getting rid of fluid. They are reclaiming water, regulating sodium, controlling potassium, helping maintain calcium and phosphorus balance, and removing waste products created from normal metabolism. That means when the kidneys start to struggle, the problem does not stay neatly inside the kidneys. It shows up in fluid, pressure, minerals, energy, swelling, urine changes, and sometimes even the brain, the heart, the bones, and the skin. So when I tell you kidney disease matters, I want you to understand this is not some tiny, isolated issue. This has body-wide consequences. Inside each kidney are tiny filtering units called nephrons. You are born with a large number of them, and each one is precious. These nephrons are doing the microscopic work of filtering your blood, keeping the good stuff, and sending the waste out through urine. The problem is, once enough of these filters are damaged, your body can compensate for a while. It can hide the loss. That is why kidney disease can develop silently for years before the average person realizes anything is wrong. So what damages these filters? The 2 biggest causes are diabetes and high blood pressure. Diabetes exposes the filters to chronically elevated blood sugar, and high blood pressure exposes them to excessive force. Think about that combination for a second. On one side, you have sugar-related injury affecting delicate tissue. On the other side, you have pressure physically stressing tiny blood vessels. Over time, those filters become inflamed, scarred, leaky, and less effective. With diabetes, high blood sugar does more than float around harmlessly in the bloodstream. It changes proteins, damages vessel walls, increases inflammation, and contributes to scarring. With high blood pressure, the kidney's delicate filtration system gets pushed too hard for too long. And when those 2 problems show up together, the risk rises even more. That is one reason chronic kidney disease is so common in people who also have metabolic issues, cardiovascular issues, or both. Now here is where this gets tricky. In the early stages, kidney disease often does not scream. It whispers. It gives subtle clues, not dramatic alarms. A person can have declining kidney function and still go to work, still drive, still exercise, still do normal daily life, and still assume everything is fine. That delay is exactly what makes chronic kidney disease dangerous. By the time symptoms become impossible to ignore, significant damage may already be present. So what is one of the first signs that many people notice? It is waking up at night to urinate more often than usual. That is called nocturia. And yes, there are many possible causes of nocturia. It can happen from drinking too much fluid late in the evening. It can happen with sleep disorders. It can happen with prostate enlargement, certain medications, overactive bladder, or other issues. But when nocturia starts happening regularly, especially in someone with diabetes, high blood pressure, swelling, or abnormal urine. It should not be brushed off. Why does this happen? Because healthy kidneys concentrate urine in a very organized way. They know how to conserve water when appropriate and how to keep the body balanced through the night. When the kidneys lose some of that precision, the urine concentrating ability can change. That means more urine production at night, more interrupted sleep, and more trips to the bathroom when ideally you should be sleeping through the night. And the reason this sign is so easy to dismiss is because people create harmless explanations for it. They say, maybe I just drank tea too late. Maybe I'm getting older. Maybe it's stress. Maybe it's nothing. And once in a while, maybe it is nothing serious. But when it becomes a pattern, it deserves attention, because patterns are often where the body tells the truth first. Now, nocturia is not the only clue. Another early sign can be foamy urine, especially persistent foam that keeps showing up rather than disappearing immediately. That can sometimes suggest protein in the urine. Protein is supposed to be kept in the bloodstream, not leaked out in significant amounts. So when the filter becomes damaged and starts letting protein slip through, the urine can change. That does not mean every bubble is a kidney problem, but persistent foam is worth checking. Then there is swelling. You may notice puffiness around the eyes in the morning, tighter shoes by the evening, swelling in the ankles, swelling in the feet, or even rings feeling tighter on the fingers. When the kidneys struggle with salt and water balance, or when protein loss becomes significant, fluid can start collecting where it should not. Sometimes it is subtle at first, sometimes it is obvious. Either way, unexplained swelling should never be ignored. Fatigue is another clue, and this one is tricky because fatigue has 1,000 causes. But kidney disease can contribute to fatigue in several ways. Waste products can build up. Fluid and electrolyte balance can shift. Red blood cell production can be affected because the kidneys help signal the body to make them. That means a person may say, I'm sleeping, but I still feel drained, foggy, or weak. If that sounds familiar along with other signs, pay attention. You may also see changes in appetite, nausea, muscle cramps, itchy skin, trouble concentrating, or an increase in blood pressure that becomes difficult to control. Again, none of these symptoms alone automatically means kidney disease. But when you start seeing clusters, especially with risk factors, the picture becomes much more important. Now let's talk about risk for a second, because this is where a lot of people miss the story. If you have diabetes, high blood pressure, heart disease, obesity, a family history of kidney disease, a history of kidney stones, frequent urinary infections, or long-term use of certain pain medications, your threshold for getting checked should be much lower. The same is true if you have autoimmune disease or belong to a population with higher risk of chronic kidney disease. You do not wait for a dramatic symptom if the risk is already sitting right in front of you. And this brings me to one of the biggest mistakes people make. They wait for pain. They assume if the kidneys are in trouble, there has to be pain in the lower back or pain in the side. But many forms of chronic kidney disease are painless, especially early on. Kidney stones can cause severe pain. Certain infections can cause pain. But chronic kidney damage can progress silently. That is why the absence of pain should never reassure you too much. So, how do you actually recognize kidney disease early in a practical way? You look at 3 things. You look at symptoms, you look at risk factors, and you look at simple lab tests. Those lab tests matter because the kidneys can be declining long before the body makes the message obvious. The first test many people need is a urine albumin to creatinine ratio, because this can help detect abnormal protein leakage. The second is a blood creatinine level, which is used to estimate kidney function through something called eGFR. And the third is blood pressure, because uncontrolled pressure is both a cause and a consequence of kidney disease. If you have diabetes, your glucose control matters too, because protecting the kidneys means protecting them from chronic sugar injury. This is why I tell patients not to guess. Check. If you are waking up at night again and again, if your urine looks consistently foamy, if your ankles are swelling, if your blood pressure is rising, if you feel unusually tired, do not just normalize it. Get the labs. The kidneys reward early attention and punish long neglect. Now let's talk about what you can do, because awareness without action only gets you halfway there. First, if you have diabetes or prediabetes, work on blood sugar control. Not casually, not someday, consistently. The kidneys do not care about good intentions. They respond to what your blood sugar is doing day after day after day. Second, protect your blood pressure. For many people, this is one of the most important kidney preservation steps they can take. Third, be careful with medications that can stress the kidneys, especially frequent or heavy use of NSAID pain relievers, unless your own clinician tells you otherwise. Fourth, do not smoke. Smoking damages blood vessels, and kidneys are full of delicate blood vessels. Fifth, know what supplements, powders, or herbal products you are taking. Natural does not automatically mean kidney safe, especially if kidney function is already reduced.
Sixth, pay attention to salt intake if your clinician has advised you to do that. Too much sodium can worsen blood pressure and fluid retention. Seventh, stay reasonably hydrated, but do not force absurd amounts of water thinking more is always better. Hydration should be appropriate, not extreme. And eighth, if you have sleep apnea symptoms like loud snoring, witnessed pauses in breathing, or severe daytime sleepiness, get that evaluated too, because sleep apnea can worsen blood pressure and strain the kidneys over time. Exercise helps, weight management helps, managing cholesterol helps, treating diabetes helps, treating high blood pressure helps, treating the whole metabolic picture helps. And I want to emphasize something important here. Kidney disease prevention is rarely about one magical trick. It is usually about repeatedly doing the boring protective things before the damage becomes dramatic. Now, if you are wondering whether nighttime urination always means kidney disease, the answer is no. But if it is new, frequent, persistent, or happening alongside risk factors, you should treat it like useful information, not background noise. Your body is not bothering you for entertainment, it is sending data. And one more thing, a lot of people will say, "My labs were okay once, so I must be fine." But trends matter. A single normal result does not give permanent immunity. If you have ongoing risk factors, kidney monitoring has to be part of your routine health strategy. Especially if you have diabetes or high blood pressure, regular testing is not overreacting. It is smart maintenance. So let me give you the simple version. If you are waking up to urinate multiple times a night, noticing persistent foam in the urine, seeing swelling in the feet or around the eyes, feeling unexplained fatigue, or dealing with hard-to-control blood pressure, those are signs worth respecting. Add diabetes, high blood pressure, heart disease, or family history to that picture, and the importance goes up even more. The best time to catch kidney disease is before the symptoms become loud, before the swelling becomes severe, before the fatigue becomes overwhelming, before the blood tests are far outside range, before dialysis is even part of the conversation. That is the window you want. Early recognition, early testing, early protection. So if this topic sounds personal to you, do not wait for the perfect moment. Ask for kidney testing. Ask what your urine albumin result is. Ask what your eGFR is. Ask whether your blood pressure and blood sugar are truly in a kidney-safe range. And if you already know you have kidney disease, the question becomes, how soon can you tighten up the things that slow progression? Because the truth is, your kidneys do extraordinary work for you every single day, and most people do not appreciate that work until the system starts slipping. But you do not have to wait for a crisis to take them seriously. If you recognize the signs early, you give yourself options. You give yourself time. And with kidney disease, time matters more than people realize. And if you remember nothing else from this conversation, remember this simple idea. Kidney disease is often not about one dramatic moment. It is about repeated little signals that are easy to ignore until they start adding up. Nighttime urination, foam in the urine, swelling, fatigue, rising blood pressure. Those clues may seem small on their own, but together they can tell an important story. So do not let familiarity make you careless. Common does not mean harmless. If the signs are there, respect them, investigate them, and act early. That approach can help preserve kidney function, protect your heart, improve your quality of life, and prevent the kind of regret people feel when they realize the warning signs were there long before the diagnosis became official. And for many people, that first step is not treatment, it is attention. Notice the pattern, respect the pattern, and let testing confirm what your kidneys may already be trying to tell you.